Just a few housekeeping as well. So the slide deck will be shared shortly with you following this training session. The webinar will be recorded and it will also be posted on the RGP Toronto YouTube channel. And again, please type your questions that are related to the content into the chat. And at the end of the webinar, we will have a question and answer period. Also, please note that this webinar is not intended to be a substitute for professional medical advice. So this is our 16th presentation in the PRCP webinar series for healthcare workers. Today's webinar is titled Wayfinding and Dementia. So I'm going to introduce our presenters for today. So first we have Jennifer Blake. Jennifer Blake is both a care partner and a health professional. Her drive to improve the quality of life in long-term care is evident in her passion as a family advocate and educator. She has worked in long-term care and community for the last 22 years and has worked for the regional municipality of York for the past 13 years in various positions in seniors community programs. Jennifer is an active member of the Design and Dementia Community of Practice, who wrote best practice for design in long-term care and community settings. She has contributed to the modules on lighting, noise, doorways, wayfinding, and she's currently working on outdoor spaces as well. And she's been able to share this research right across Canada with webinars and workshops. Helly Uwola is a psychogeriatric resource consultant with the Regional Geriatric Program of Toronto and based out of Sunnybrook Health Sciences Centre. She has worked for over 20 years in the field of seniors mental health, both in hospital and in her current knowledge to practice role. Driven by a focus on quality of life, she works to support staff as care partners in delivering the best quality of care possible. And with that, we will get started. Again, please feel free to type any questions or comments that you have in the chat box at any time. We will have time to address all of your questions, hopefully towards the end of the webinar. And I'll pass it over to you, Jen.
Great, thank you. Well, good morning, everyone, and thank you for joining us. So today we're going to talk a little bit about wayfinding and dementia. And I think the best way to start our presentation off is just talking about, have you ever been lost in an unfamiliar place? And so I'm sure most of us can think back to a time where either it was in a busy parking lot, in a shopping mall, and think about some of those feelings that you had. I know for me, the one that I remember most is being lost in Canada's Wonderland parking lot. We were tired, we were wet after going on rides, and then at the end of the day, you're trying to find your car. You're walking up and down the aisles, looking for a white car, where you can see in this picture how many cars are white. And so you start to panic a little bit. You start to think, where am I supposed to be? Is this the right area I'm supposed to be going in? And again, with this example, I had kids that were saying, Mom, it's this way. No, it's this way. Come down this road. So think about some of those physical symptoms you may have had. Was your heart beating a little bit faster? Maybe your palms were a little bit more sweaty, because then you do start to doubt yourself and think, where am I? Where am I supposed to be? Where did I start from? So think about some of the ways that helped you cope or manage in that situation. Maybe did you take a picture on your phone so that you could look back and say, oh, right, we were in section D. So then you could, make your way back to section D. But now think about yourself as a resident or a client having dementia and how you would feel being lost in this space where everything starts to look the same and you're not really sure on your way back. You're not really feeling secure or safe in your environment. You can imagine how overwhelming that would be. So that's really where we started talking about understanding wayfinding. We thought that it was really important to share the best practice around these themes. So today we're going to cover a few of these themes and recommendations for you that, that the community of practice has put together. So we're going to talk about floor layout. We're going to talk about hallways. We're going to talk about some of those landmarks in my example, memory boxes, washrooms, and meaningful engagement. And through those, you'll be able to pull information that hopefully you'll be able to take back to your organization and make some implementation or some changes to your long-term care home, to your hospital, to your adult day program. So when we talk about wayfinding, the actual definition or example, it really is that system of navigation that helps us find our way with independence within that built environment. And that piece around independence is so important because, like I said, it's helping people feel safe and secure in their environment to be able to find, I want to be able to move from my room to the dining room with ease, without stress. And so it really does include knowing where you are, knowing that destination, and feeling the best about the route. And then also being able to find your way back. So why is it important? Well, when we talk about autonomy, quality of life for people living with dementia, it really is linked with that ability to reach that certain place within their environment with success, like I said, feeling safe and feeling that they are in control of that place or that environment that they are now calling home. An important investment for all of us as far as healthcare workers, we can help to reduce that anxiety, reduce those responsive behaviors by implementing some of these recommendations. So really, we do know that spatial disorientation is one of the prime reasons for coming into long-term care. Someone being in their condo building and not remembering what floor they live on or getting lost in that space. A lot of times that does lead to coming into long-term care or a retirement home. So the first piece that we're going to touch on is talking about floor layout. So the recommendation that we've put together for floor layout talks about floor plans being simple, not repetitive, and it really does help to increase the wayfinding ability. And I think this piece is so important because we are, with the big announcement about building lots of new builds, we really do need to think about floor plans at this time. Before we start to build, we need to have that input from residents, from clients about that co-design. They need to be part of that planning when we're talking about floor layouts. So what are some of the things that we can do to implement some of these suggestions or recommendations? So we've really been able to kind of separate the information into low or easy to implement strategies, and then maybe some that are a little bit more costly in our presentation today. So what are some of the easy to implement strategies? Really looking for reference points or landmarks within your home areas or your space. So, pictures or signage, while avoiding that clutter. You don't want to have pictures and arrows going here and there and everywhere, but simple signage that will help to direct that person to the space so that they are successful in finding their way. Some of the more high or costly strategies that we can look at, like I said, when you're talking about putting that build together. So looking at design as far as a straight or a direct layout, and then you want to really look at, we suggest as far as home areas, looking at an L shape or an H shape or even a square shape, where it does help with better orientation. And really the kind of the rationale or the understanding behind this is it really does help as far as visual access to those spaces so that they can see, okay, there's the dining room, I'm almost there, or there's the activity room. And it gives them that, like I said, that increased independence, that they can find their way safely without having twists and turns and multiple, dead ends, things like that, where they aren't going to be successful. So floor plan design in long-term care homes really does have a big influence on residents' orientation and wayfinding. And it doesn't mean effective floor plans don't mean less signage. It just really means, like I said, using that signage in a successful way so that they can maybe have a distinct space, or the themes or rooms are easier to find. So again, with this piece around floor layout, these are still some more costly ways, but looking at proximity. So again, you don't want to have long hallways where, that resident has to walk, for such a long distance, because again, a lot of times they will give up, or they'll turn around and go back to their space because maybe they're tired, or they don't feel successful. They don't feel that they're finding their way. So kitchen and dining room and activity rooms, if they're kind of in a hub or a space where they can find their way, and then there is that reduced anxiety, where those floor plans are simple and easy. So you want to make a distinction with floor plans. And again, wayfinding versus uninterrupted pacing. So again, making sure that those destinations, they can be successful. Like I said, avoiding those dead ends, or having bench seating for those with walking limitations. So for example, you want them to make it to the dining room, but again, you don't want them to get distracted by having all of those corridors or different exits or entrances where they can then sit, and then maybe they won't remember where they were heading to. So instead, when you have those floor plans that they're going to be successful, it is going to allow them for that success. So when we talk about hallways, some of the recommendations that we suggest, and we know this one's a tough one, that we want hallways to be clutter-free. So again, with few decision points between the destinations, and clear visible endings to provide that safe pathway. So what does it mean as far as clutter-free? Well, you want to make sure that you don't have lots of garbage bins or laundry carts or lifts and things like that that are making the hallway very hard for them to find their way to their destination. Because if you have a electric wheelchair that's kind of sitting out in the hallway, will that change the direction of the resident and send them on a different path? So again, you want to make sure that that pathway improves their orientation. So what are some of the easy to implement strategies? Well, like I said, so you want to make sure that those larger items are kind of pushed back in the alcove or in a recessed area, so it doesn't take away from that pathway for them to be successful. This one's a big one, avoiding flooring with patterns or reflective shine, high glare. I'm sure all of us can give an example about, a time that you've walked down maybe a hotel lobby or something like that, and it's been very high glare or shiny, and you really could think that it's a puddle or that the floor is wet. Or when a carpet, the pattern on the carpet is very busy, and it looks like, maybe someone spilled paper, or there's bits of garbage on the carpet. And so people try to pick things up off the floor because of the pattern. And oftentimes we do see that homes or agencies make that mistake because they're looking at a very small swatch of carpet sample, and then they, put it in or finally install it. And then they're thinking, oh my gosh, look how busy it is. I remember myself, for one example, we had one long-term care home, and they did implement a beautiful carpet in this new den area, and none of the residents would go in because the carpet that they selected actually looked like snakes. It was like a cream kind of swirl on the carpet, on this darker carpet, and it looked like it was a bunch of snakes on the floor. And so they ended up that they had to rip out the carpet because the residents wouldn't even enter into that space because of the look. Okay, so with the rationale there, we want to make sure that they can see their destination. So like I was saying, placed areas where there could be a nice place for them to rest, or something for them to engage in. So a lot of times we talk about destination spaces, or the best way to keep kind of those short corridors clean and open is to reduce that confusion or busyness and clutter. So handrails also assist people with general wayfinding. So a lot of our residents or clients might hold the handrail all the way to the dining room. And so that does give them that confidence to find their way to the section or space where they're looking for. Now, sometimes I have seen in some homes where they introduce different shapes or textiles along the way as well, or even some of the braille pieces when there is a stop in the handrail. And so then they're giving that person giving them that cue that the handrail is stopping and that it will continue. So just some of those different supports for them. So enhancing dead ends in corridors by creating those seating activities or life skill stations. So I did see a question pop up about that. So I'll show you an example of some pictures of life skill stations that are at kind of those dead ends, so that if someone does find their way to that space, that at least there's something for them to engage in safely, instead of finding a dead end and thinking, oh, great, now what do I do? Now where do I go? And then they do sometimes, increase in agitation because they're feeling, oh, I'm lost. Where am I supposed to be? Where something like a life skill station or, a nice seated area, might reduce some of that anxiety. Okay, so let's look at some of the pictures that I've included. So this was a picture of a long-term care home with a dead end. And so you can see that there's nothing at that end. And what we found actually was the last door was a resident space, and a lot of people did gather there because they didn't know where else to go. When they made it to that dead end, then they would all gather in that residence space because there was a chair there. There was somewhere for them to sit. And so we did have to, or some of the suggestions that we did make were to camouflage the door so that it wouldn't, so they would say, oh, it's just a bookshelf, or, oh, it's just a dining hutch down that way. I don't need to go down that hallway. The next picture is one of our life skill stations. So we implemented this in one of our long-term care homes, and we put an office as a life skill station. So there's an old typewriter, an old telephone, and they're all epoxied down to the desks so the clients or the residents can't move them from space to space. And we had quite a few professionals that would go and sit there in the morning, read the newspaper. We would give one gentleman his files for the day, and he would kind of look through his files and feel that's kind of how he started his day, was just having his coffee down there, looking through the files and reading the paper. And again, it made him feel safe in that environment. And then this is another example of another life skills station at the end of a hallway. And we were able to almost make it like a general store. So every month they would change the theme on the shelf. So, one time it was just all hats. One, season, they would put, boxes of different cereal types, just like cardboard cereal, so they could do some shopping. You can't see in the picture there, but there actually is a cash register, so they could, push the buttons. Again, the cash register was epoxied down to the table. There's little shopping carts. And again, at the end of the day, the staff on that home area would just collect the items and put them back on the shelf for shopping to resume the next day. So some of the higher cost implementation pieces as far as hallways, looking at flooring for sure can be quite costly. So I know probably everyone's going to groan when they read this, but we do suggest a carpet as a preferred flooring because it really does minimize a lot of noise and it takes away that glare. But there's so many concerns, I know, with cleaning and maintenance and infection control with carpeted flooring. I know a lot of the homes have gone to carpet tiles so that you can just remove that one tile of carpet that maybe has had a spill or, lots of traffic and it's worn down. So then they can replace that one piece of carpet tile as opposed to replacing the whole section. Some of the alternatives, again, a little bit more costly, but cork floors, they're just a little bit softer as far as if we do have some falls or rubberized tiles. And again, then, they're a little bit easier to clean, but we have found success with some of the homes. But again, a little bit more costly than just a carpet. Okay. And then next we'll talk a little bit about landmarks. So with landmarks, it really is that placement or cueing of a landmark to assist with recognition, orientation, or decision points. So think about some of the places maybe you've traveled and you say, okay, let's meet at the Sky Dome. Let's meet at the CN Tower. Let's meet at the aquarium. So those are those landmarks for you when you're wayfinding around the city. And so again, it's the same for our residents or clients when they're in their space. Those landmarks help orient them or give them cues to where they are headed or where they're going. So whether it be, a grandfather clock at the end of this hall will cue them, oh, okay, then I know I'm near the activity room as soon as I see that grandfather clock. And so it does really help with, giving them that confidence to find their way and navigate on their own. So some of the rationale, again, behind that, landmarks are defined as orientation cues, and they do give those reference points or focal points within the different spaces. And landmarks do or can create interior spaces with distinctive architectural elements. And I've seen in different long-term care homes, and again, different culturally specific homes, they find different cues that are meaningful to the residents in that space, whether it be color, whether it be, like I said, those landmark items. So a grandfather clock to me might be important, but maybe for someone else, it would be more successful. A piece of artwork or a hanging quilt might be more successful in that space. Furniture and names of rooms can also help. So, things that tend to be in a living room will give them that cue that, oh, okay, I can come in here and I can sit and watch TV because of the landmark items that are in there that they can see and that are familiar. Where again, something that might be found in a kitchen, a hutch with plates and familiar items, then they might say, oh, okay, this must be where I eat, because that's a familiar space. Color as well is really important and can highlight and both camouflage. So it can be used for both exits that you don't want people to go in. So you would paint it the same color as the hallway so that you don't want to bring attention to that space. And I know Helly's going to touch a little bit more on that as we go through the presentation, because I've had some really good success in some of our long-term care homes and adult day programs when we've looked at color, specifically changing door colors and on washrooms. So when we're looking at warm colors in the environment, such as oranges or reds or earth tones, that's going to prove to stimulate the nervous system, where cool colors such as greens or blues are going to do the opposite. They're going to slow that nervous system. So depending on what you're looking for, and again, we can certainly support you in giving you some more information around color, because we could talk about that all day as well. There's lots of literature and information on that, especially with design and dementia. But what I find I do for a lot of our homes when I come in to talk about some of these design implementation pieces is I get people to wear some glasses that are kind of tinted with a yellow hue and get them to walk around their space and make them walk in that space, because as we age, our eyes, we tend to have a more yellow lens, and so that it gives everyone kind of that experience about feeling or seeing the world through the resident or the client's eyes, and looking at the different colors and what they see and what they feel in that space, and how that color looks. So like I said, some of these easy to implement strategies, putting those landmarks at different entrances like clocks, artwork, hanging quilts, and furniture items that the person will find meaningful. What you want to make sure that you do is avoid repetitive elements. So you don't want to have a grandfather clock at every break in the hallway. You don't want to have, the same dresser or the same sofa at every space, because that will tend to cause confusion, and then the resident or the client might head down that hallway thinking that that's their cue to turn towards the dining room. So make sure that you're aware about the furniture and the placement, and you want it to like I said, support them in their way on their journey to find the space that they're looking for. So here's another example of a successful landmark. So this is in one of our long-term care homes, and what they've done is they've painted a beautiful bakery scene here so that the residents feel that they're coming to the cafe. So when they see that mural, they know that they've arrived at the dining space. And so that you can see it's a beautiful bakery scene, and it is actually very there's lots of dimension in the picture. The brick below, they can feel the brick, and it is a very tactile mural as well. Very easy to clean, because I know that's always a question. You can wipe down the mural, because people do tend to look at the window. Because it is a window, we chose to do it as a window instead of something where people would try to tend to grab the food. But because it is a bakery window, we don't have a lot of the residents trying to grab at the bagels or the fresh bread or the pastries, because they know that they're looking through that window scene. Okay. So again, some of the other kind of recommendations for you. We do have some audible landmarks that have been successful. So I know one of our long-term care homes actually has an audible door that will then alert people with a visual impairment to say, yes, you're safe to exit this doorway. This is the doorway to outside, to the patio. And it just alerts the resident that the door is open and that they're able to safely go out to that space. I'm sure most of you know around avoiding mirrors, because that does tend to increase confusion and anxiety, that if someone does see themselves in the mirror, a lot of times they don't recognize it as themselves, and that can increase their confusion or, oh, who invited them here? I don't want anything to do with them, especially if it's in their home or in their washroom. They might not feel comfortable in that space. If they're seeing that reflection, they might feel that someone's watching them if they don't recognize that person in the mirror. Okay, I think that's all on my section. I'll hand it over to Helly to continue.
Great, thanks so much, Jen. Yeah, and I'm going to carry on with the next 3 recommendations that come out of the Wayfinding community of practice. So the next one we're going to be looking at is memory boxes. And I tend to think of this as really that landmark to help folks find their own space, to find their own room. We know that memory boxes can be helpful in helping persons with dementia to locate their room. So the recommendation is to create memory boxes or personalized collages by the room doors of persons with dementia, which contain objects that are special to each individual and are kept in or outside of their room. And part of this that I was also thinking about was that as we were looking at the picture of the hallway that Jen had shown us, it was just that long corridor, the walls were white, the doors were white. Another thought around the use of color would be to paint each individual person's door a different color. You can just imagine how that hallway would have felt and looked quite different if there had been the use of color in that space that way. But really, this is helping people to be able to find their way successfully and independently to their own space. So some of the lower effort or easier to implement strategies for memory boxes include filling the box with personalized items that are interesting and meaningful, and doing this by creating the box with the person who is living with dementia and their care partners. And really, again, it's this idea of keeping things very visible and accessible for people. Part of this is also utilizing special markers to individualize and identify rooms of interest to provide those extra cognitive cues. We know that when people are able to successfully navigate their way around a space, it does help to decrease stress, and it decreases the amount of effort that's required to wayfind in a space, and this increases independence. We know that part of making this successful is when we're looking at memory boxes, choosing items that come from someone's earlier life. So childhood or early adulthood are the time frames that we want to be looking for photographs from those times, or items of special interest to that person or have a special meaning to that person. The reason we've got the pictures of the planes for this particular slide is a bit of a visual cue to myself to talk about a fellow who had moved into a long-term care home, and he was having difficulty finding his own room. And the staff found out that he'd actually worked as a pilot, and what they did was they printed off several pictures of different planes and had them on the front door, on his door, his room door. And this actually increased the ability of him being able to find his own room and being able to successfully choose which room he wanted to go to when he saw the pictures of the planes. The other thing that memory boxes can do is, as the person progresses on their dementia journey, is it does allow people to still get to know who is this person behind the disease when they're able to see some of the items that are in the memory boxes. So the next area of wayfinding recommendations we're going to look at is around washrooms. So the recommendation here is that toilets should be visually accessible and easy to find for persons with dementia. The setup of the toilet areas should encourage and cue independent use through visual access and legibility. So we know that when there is visual and perceptual access with good signage it does help people with dementia to be able to find toilets successfully. So not only washrooms, but other important areas you may be helping to cue people to be able to find. And again, this really does promote people's independence and at the same time is able to reduce anxiety and could reduce behaviors such as searching behaviors or folks who may be trying to leave the building. We know that sometimes those behaviors are happening because people are looking for these spaces and they just aren't able to do so when there isn't the environmental cueing available to be able to find those spaces. So the first set of recommendations that we have for the washrooms that are easier to implement or potentially a lower cost to implement include the following strategies. So the first one is the removal or camouflaging items in the washroom that resemble a toilet bowl. And I feel like this is one that I've heard time and time again, where someone is able to successfully get their find their way to the washroom. But once they're in the washroom, there's another decision point to be made because there is a toilet, and then right next to that might be the waste paper basket. And they look fairly similar. They're about the same height. They're about the same shape. And so the person has to be able to decide which item to use. If we simply remove the waste paper basket, it reduces the number of options available to that person. It reduces the number of decision points that have to be made. And so it increases the chance of that person being successful with being able to use the toilet independently. So thinking about, if you have individuals in your environment who may be mistaking other places for the washroom, what is it in that environment that might be cueing them to think that that might be a place to use the washroom, or looking at how we can reduce those choices. The next point also goes along with this idea, and this is consider removing other distracting items to encourage direct focus on toilet utilization. So we know that folks can become overstimulated, especially if there's a lot of items within the environment. And so we want to think about reducing the number of items that are available in that washroom environment because it may interfere with the task that we're trying to promote them to be able to accomplish independently. And the next one is also another important one and can really help, again, with that independent use of washrooms. And this is contrast. And so this is going back to some of what Jen had also talked about, but contrast is really key. Thinking about the contrasting color of toilet seats with the background wall, with the flooring, and with the toilet bowl. And so this is a great picture of a washroom. And if memory serves me correctly, this is actually from Charles de Gaulle Airport in Paris. And so this picture is courtesy of one of the community of practice members with the Design and Dementia group. But we can really see here how the use of color changes that environment. We can see the very bright orange toilet seat cover over the white toilet bowl, but there's a very dark floor underneath it. So there's a lot of contrast in this picture to enable people to be able to see that space. And if you think back in your organization, what do the typical washrooms look like? Oftentimes I find washrooms in organizations are very light, pale colors, if not white. So we've got the white toilet bowl with the white toilet seat cover against some white tiles on the floor and white paint on the wall behind the toilet. And so even doing something as simple as just painting out the back color of the wall behind the toilet, or thinking about buying new toilet seats that are a different color plastic than the actual bowl underneath. All of this can really help to create that color contrast, which are going to increase the chances of people being able to actually see where the toilet bowl is actually located. Another part of helping people to successfully be navigating an environment, finding washrooms, thinking about supporting personal patterns and routines. Again, we know that that can really help with people who are searching in the environment for the washroom. So if we can learn what their personal routines are and setting up toileting schedules can help with this part of maintaining independence. Also in an environment, thinking about cueing and signage and really designing effective signage. So again, we've got some great pictures here as examples to share. So you can see again that high color contrast And what the recommendations actually suggest is it's preferred to have dark font with a lighter background, but we really want to think about that high color contrast being one of the keys to helping people to be able to see the wording. Also thinking about the size of the font, we want to make sure the font is nice and large. And we also want to think about the type of font that we're choosing, that it's not too complicated, that it's fairly straightforward, and the letters really represent what we want those letters to look like. As you're looking at that orange door, again, lots of really great wayfinding cues with this. You can see how that bright orange door really stands out against the walls. And you can notice too that the handrails are also a wood color. So they also stand out nicely against the walls. And so we really want to be able to make sure that the things we want people to see stand out from the background. If those handrails or that door was painted the same color as the wall, everything could potentially just blend in and it might be much harder to find. The other part of this that you'll notice is on the orange bathroom door, there's a picture of a toilet. And so helping people to identify spaces with pictures can also be very helpful. And if you look at that orange door, the third sign down is the typical signage that we often see related to washrooms, and those are the silhouettes of people. We do know as someone is on the dementia journey, the further they get on the journey, the more challenging it is to be able to understand what that signage actually refers to. So having things that are very concrete and having the words are much more helpful for people. Another part of this we want to think about is the height at which the signage is placed. And so, in your environments, do you have folks that are walking upright, but do you also potentially have folks that are walking upright but have a downward gaze? And so they're not looking at things at eye level. Or do you have people that are moving around in your environment who are in wheelchairs? And again, thinking about where the eye level is. So thinking potentially about having signage at different heights to also help people to be able to find their way around the environment. The last one we're going to look at is one of the ones that probably many of us are going to have not much input on, but as Jen mentioned, if you are in a position where you know your organization is looking at modifications, renovations, or a long-term care home with a new build, this is the time to really think about that floor plan and the footprint in which we're building spaces, because we do know that when toilet rooms are visible, it really does increase the chance of people being able to successfully find the bathroom and be able to use them, which is going to increase independence. So we know that through visibility and effective signage, it promotes that independent use of toilets, but we know that if finding the washroom relies solely on the use of memory, it's going to pose more of a challenge. So thinking about where those washrooms are actually physically located. Okay, and the last recommendation we're actually going to explore a little bit today is meaningful engagement. And so the recommendation here states, use meaningful engagement to draw familiar life experiences, past roles, and include everyday life events. Activities should be significant to the person with dementia and not just used as a diversion. And so really recognizing the role that meaningful engagement can have as a part of cognitive stimulation. But it also helps with promoting participation, engagement, and enjoyment. So really looking at how this is going to help our folks to be able to learn daily activities, find ways to be socially interacting with others, as well as alleviating boredom. So in terms of some of the I think, more easier to implement ideas we can consider for meaningful engagement is thinking about the seating and how seating is arranged in your organization. So arrange seating areas that maximize visual access to other areas of the facility. So this would include seating in the dining room, the lounges, corridors, and all other spaces. Again, if people are able to see where things are happening, it's going to help them to identify opportunities for engagement, whether they're organized activities or more informal activities that are available within your organization. Part of this is also creating a regular schedule so daily life experiences are in the same place and the same time of day. So we do know that routine is very helpful to the structure of the day and to the structure of activities for people who are living with dementia. So along with this, we can also think about, again, signage, the use of signage with specific colors or images associated with a specific activity or experience are going to be helpful in directing people to the proper purpose of the room. So again, it's thinking about visibility and access. You might also think about, if it's say, for example, a long-term care home where people are residing in that space, thinking about where can we have meaningful activities available for them in their own rooms. If things are tucked away in drawers or in cabinets, people might not be able to find those activities. So thinking about how we might be able to have things kept out so they're visible for individuals living in the space. And the next one I really enjoy as well, and that's as a positive cue, using music, sound, or scent from an activity room, as we know that this can attract residents into the space and encourage activity. Excuse me. Part of this is, thinking about the ambiance in the environment. And we know that things like meals and snack times are often a highlight during a person's day. So how can we elevate that experience for people? Think about when you walk into a space and you can smell freshly brewed coffee or freshly baked bread, and how that can really stimulate appetite, but also it just really makes it a much more pleasant experience. So thinking about how scents might be used. Thinking about during care time, if someone is having a shower or a bath. Again, thinking about spa-like smells, using things like bath soaps to be able to really elevate and make it a much more meaningful experience for the individual. So moving along with meaningful activities, also thinking about how just day-to-day activities can be meaningful to persons with dementia, as many have expressed the desire to help out in their communities with some of the daily activities and chores. So just thinking about those ordinary domestic tasks that we all are part of. And also thinking about this common human need that we all have to feel productive and to feel valuable. And knowing what activities somebody might be interested in doing, and what might bring them a sense of enjoyment and engagement. There was a story, and again, this is another one of the examples we often hear, and it's so wonderful to hear, where there was a man who the staff found out had worked in environmental services. And so what they ended up doing with him was they just gave him a clean cloth daily, and he would walk around in the space cleaning. And so it was connecting to him to something from his past. It was meaningful to him. It helped him to feel like he was contributing in a valuable way to the community that he was a part of. So looking for those types of opportunities to really engage people in meaningful activities. So the next couple of ones we're going to look at are some of the more challenging ones to implement. There might be more of a cost associated with it, or again, it comes down to the footprint of the actual physical layout that we may be working with. But it's thinking about outdoor spaces and access to outdoor spaces. So here we've got the recommendation that windows that show accessible outdoor spaces can provide cues to engage outdoors. Unfortunately, we know that that's not always a possibility in all of the environments we may be working in, but recognizing the importance that being outdoors can have for all of us. So I love this picture because this is actually a long-term care home where they've really capitalized, I think, on the windows at that end of the hallway. So it's not a dead-end space, but it's actually a lovely park-like feeling space that residents in this long-term care home can actually visit during the day, and they can actually see what's going on with the weather outside, and you can see the lovely bushes and the greenery outside of the window. So thinking about how we can try and maximize visual access if we can't maximize utilization of outdoor spaces. If we do have outdoor spaces, thinking about how with having strategic plantings and accessible pathways, it's going to help folks to utilize that space. With pathways outside, also important to make sure that they loop back to how the person was able to get outside. So again, so people are having successful cues with being able to find their way not only out of a building, but also back into a building. but also thinking about having public and private areas in outdoor spaces, because we know that all of that can promote and provide opportunities for the person with dementia to engage in positive sensory stimulating experiences. So all the more better if you also have additional experiences that they can participate in outside, thinking about the folks that love to go gardening, and work in outdoor spaces, and that could be another meaningful activity. Also thinking about all of the benefits that we all get from being outside. Sunlight exposure and how that can help to maintain our circadian rhythms. We're all hearing about the importance of going outside, going for a walk, and we know that being in nature is something that is beneficial to our well-being and can help to lower stress, as well as just thinking about those opportunities to engage in outdoor activities. So really thinking about how we might be able to promote that within our spaces. And the last one I'm going to touch on is this idea of creating smaller, more home-like spaces that are accessible within an organization. So the example we have here is an activity kitchen, but if you do visit the Design and Dementia Community of Practice recommendations, there are other types of spaces that are listed there. The idea here is that within that space, we want to have objects that create continuity with home or past life experiences within the spaces that are really reflective of people's past interests and their jobs. And again, thinking about how these can really evoke pleasant past experiences, pleasant longer term memories. And really, it does also allow for more opportunities for spontaneous activity within your space. Okay, so some of the key messages that we just want to share as we start to wrap up the webinar today on wayfinding is the recognition that effective wayfinding really does contribute to the safety and well-being of persons with dementia. And so looking for those opportunities to be able to consider and select wayfinding resources within your organization, because it really is an important investment for the physical environments that support people who are living with dementia. And I think that we've been able to share that quite a bit throughout the webinar, but really that recognition that it is going to help with quality of life. We can see reduction in anxiety as well as responsive behaviors. So we'd really like to invite you to consider ways that you can support orientation and functional destinations within your organization, by helping persons with dementia to find them using strengths like sensory input versus relying on people's memory. And again, we invite you, if you'd like to find more information on other areas of design and dementia, things like doorways, lighting, and noise, we do invite you to visit the Brain Exchange website.
All right, so thank you so much, Jennifer and Helly, for sharing your expertise on wayfinding. I personally find this topic very interesting, and you both shared some really, really great suggestions for some of those things that we can do to help our clients and our residents to find their way, so thank you. We do have some time now for questions, so I just want to remind everybody, if you do have any questions, you can type it in the chat box. Just remember to try to change it to the to all panelists and attendees so that we can all see your questions coming through. I did notice one question in the chat, what is a life skill station? And I believe, Jennifer, you did sort of pick up on this already, but I don't know if any of you have other things or further things that you wanted to add just now that we have a little bit of time left.
Yeah, I think we were able to share some of the examples of some of the life skill stations that we've implemented in some of our other long-term care homes. So whether it be, Montessori stations, the office was an example, the general store, the kitchen, the baking center, where areas, like Helly said, where people can then engage, and it doesn't have to be a formal activity. They can engage in something that that they can just kind of pick up and look at, some of the activities like the laundry hamper or, sorting socks. They can just kind of pick it up and do that when they enter into the space.
And another one I think I've seen is like a baby carriage. Is that kind of the same sort of thing? Yeah, like a nursery almost.
Yeah. So I think Kelly did show a picture of a nursery. And again, we've had some great success with some of those stations, a rocking chair, things, again, that are familiar, those landmarks that will say, oh yeah, okay, this is a nursery. And then, someone sits in the rocking chair and then all of a sudden starts, maybe singing some of the songs that maybe they sang to their grandkids or their own children. And it really does, it invoke those memories. And like we said, reduce the agitation and the anxiety around, being somewhere that's not familiar. So instead, they're introduced into this space that they're comfortable in.
Yeah. And just to add to that, I know part of the discussion I've sometimes had with long-term care homes is the fact that things, will be taken and moved around. And so it's also working with the teams to really support them with being able to return items to the life skill stations. Because the idea is for them to be taken and to be used and to be, enjoyed. And then, but being able to replenish that supply so that we're able to work with items again the next day. So that's another piece of this, is really working with the team to support that this is a part of really making this an interesting environment for the folks that are using that environment.
And I think really what I'm pushing for now is that co-design piece. So really including people with dementia when you are doing that planning, because they are the ones living in that space. So allowing them to give or share their voice to say, you know what, I really find it helpful when, or, how can I support the resident in that space? Well, you need to talk to them and get them to give them their feedback and what's working and what's not working. Is a color that maybe we've painted, really not working for them, or like I said, those landmarks that aren't meaningful to them. And it is interesting, like I said, when you go into the different long-term care homes and finding things that are meaningful to people in that space, because the staff are maybe taking in account to be more culturally sensitive.
For sure. Before we wrap up, I just want to, there's one other question. As an occupational therapist, just curious if you have LOTs involved in this collaboration, and also that she completely agrees with the co-design, having that the person living with dementia sort of involved with the planning and experience of this.
Mm-hmm. So on our community of practice, we call it almost like superpowers. We have some amazing, people that are coming together from all different areas, and we do have quite a few OTs that are on our community of practice. We have architects, we have research, we have policy people. And so that's what makes it so unique and so fantastic, because it really is all these ideas coming together to create these best practice. So if it is something that you are interested in, we're always looking for new members and new energy. So absolutely check into the Brain Exchange, and there are links there that if you do have an interest, absolutely reach out to us on the links. And like I said, we're working on outdoor spaces now. And so if that is an interest for people, then we would love to have you.
Great. Thank you, guys. So I just want to thank all of you for attending this webinar. We are out of time now, but just thank you for showing up and being with us for this last hour. You will receive a short evaluation survey as well as the YouTube link through your email. And we do encourage you to go in and share your suggestions for any topics that you would like us to do for future webinars. But yeah, we just want to thank you, and we hope you have an amazing day ahead of you.